So yeah, having my sinus was really bad. I had a hard time like breathing. My nose always like clogged. I cannot breathe, and when you're not breathing or when your nose is clogged most of the time, so you don't have that power. You also like all the time you're sluggish. You're dragging yourself. It was really hard before the surgery. When I went to Dr. Cho and he checked it, he said, "Do you know that you're only using like 20% of your breathing?"
He noticed that he's had really bad nasal obstruction for years. He didn't know why, actually. When he came in, we looked up his nose and there was polyps everywhere. I treated him as aggressive as I could with medicine, oral steroid, oral antibiotic, topical steroids, sprays, rinses, Mucinex, just was not getting better. Poor guy couldn't smell, he couldn't breathe.
As a scrub tech working in the OR, so I saw like so many different ways doing this surgery. And I knew about like 2 or 3 years before that I needed surgery, but I didn't decide to do it until like I saw the way he's doing it.
So nowadays, what we do for sinus surgery is all done endoscopically. Balloons are not for everybody, but in the right patient, they're a really good alternative, minimally invasive, and now the recovery time is much shorter. We feed a guide wire, a fiber optic guide wire, and when the guide wire is in the sinus, it makes the cheek or the forehead light up. Once that's done, we know we're in the sinus, we feed the balloon through, and kind of like a cardiac balloon, we inflate the balloon and it will open up or dilate the narrowed opening to the sinus. Back in the day, we used to use trocars, do what's called a Caldwell-Luck procedure, cracking the nasal bones from the inside, under the lip, things like that. Nowadays, recovery is much faster, less facial bruising.
The good thing about Dr. Cho also, he's on the top of everything. He'll like call you and ask you, how are you doing? How's your nose? How are you feeling now? He also like keep follow up with you like for every week. He'll see you every week for the first month, then every 2 weeks for the second month.
I find ENT patients, particularly sinus patients, they're some of the most rewarding and grateful patients that I see, so it's really rewarding.
Now I can like work out and I have no problem. I can like running, I have no problem. I can breathe. I couldn't breathe before.